If you're turning 65 soon and you're going to be making the decision between Medicare Advantage and Medicare Supplement, there's some very important reasons why you might choose one over the other. And so in this video, I'm going to go through really the fundamentals of Medicare, Medicare Parts A and B, and then how a Medicare Advantage, which are also called Parts C and D, will fit into that, or a Medicare Supplement, Medigap, will fit into that as well. My background, I've been a licensed agent for about 20 years. I specialize in the senior market, help Medicare planning, retirement planning, retirement income planning, and life insurance and legacy planning. So diving in, Medicare Parts A and B do have some gaps, and that's why those gaps need to be filled in, or there's a possibility you could spend a lot of money on your healthcare. Part A has a deductible per benefit period. I'm going to go into what per benefit, per benefit period means. And then there's a Part B deductible plus 20% coinsurance. And there's no cap, there's no annual out-of-pocket maximum if you only have Medicare Parts A and B. And so that is important to this discussion. Skilled nursing is tied to the same benefit period rules, which is also important for this conversation. What is a benefit period specifically? So if you are admitted to a hospital is covered by Part A of your Medicare. Once you have been discharged for 60 days, your benefit period starts over. You have a new benefit period and you have a new deductible. Now that's if you have no Medicare Supplement or no Medicare Advantage plan. So once you've been discharged for 60 days, that benefit period ends. Like I said, a new benefit period will start. So if you get admitted, get discharged, 70 days later, you get admitted again, you have a new deductible. That's a new benefit period. Now, how a supplement versus a Medicare Advantage, most of the time, both of them are going to cover that deductible. So if you just have original Medicare, you would be responsible for that deductible. If you have a Medicare Supplement, Medigap, that is going to cover that deductible each time. And then a Medicare Advantage, you're just going to have a copay when you go into the hospital. And of course, that copay will vary depending on the plan, who your carrier is. Those benefit designs can be very, very different depending on where you live in the country. And then your costs will accumulate towards your annual out-of-pocket maximum. So whatever you're spending out of pocket on your Medicare Advantage, you do have an out-of-pocket maximum. Once that's hit, you won't spend anything else beyond that out-of-pocket maximum. That does not include your prescriptions. Now, Medicare, original Medicare A and B, there is no out-of-pocket maximum, as I talked about earlier. So in this example, if you have a $50,000 hospital stay, Medicare is going to pay 80%. You're going to be responsible for about 20%, and then there's no cap on that. So if it was a $500,000 hospital stay or a $1 million hospital stay, you'd still be responsible for that 20%, unless you have a supplement or an advantage plan. So traditionally, Medicare Supplement plus prescription coverage is how many people have covered their medical expenses in the last 20 years or so. The Medicare Advantage plans have become significantly more popular because they tend to be cheaper on a monthly premium. Sometimes they are zero premium, and they do offer some additional benefits that sometimes Medicare supplements do not offer. So Medicare supplements coordinate with, or sorry, I shouldn't say coordinate, but they work alongside original Medicare. The major benefit of a Medicare supplement is that you have the option to choose any doctor that you want to go see, as long as that doctor accepts original Medicare. Something I do come across with clients quite a bit is they'll call the doctor's office and the doctor's office will say, "What's your insurance?" And they'll say, "I have Anthem, or I have United Healthcare, or I have Ambetter, Centene, WellCare, Cigna, Aetna," whatever the case may be. and the doctor or the doctor's office might say, oh, we don't take Aetna, we don't take Anthem, we don't take United Healthcare. And if that's a Medicare Advantage, that may very well be the case, that they're not contracted with that insurance. But if it is a Med Sup, you still can see that doctor. They're going to bill original Medicare and bill your supplement, and they do not have to have any type of a contract with them. There's no referrals. Now, there is going to be a premium, and it's generally a higher, I mean, could be a pretty significant monthly premium to give you that access to any doctor, any hospital that you want to see that accepts original Medicare. The plans, when it talks about plan standardization, Plan G, Plan N, those plans, how they are structured is dictated by the federal government. And so each plan is going to be structured the same. If you see a Plan G from Humana, see a Plan G from Mutual of Omaha, Plan G from Anthem, the benefits are all going to be the same. And then what you're shopping really there is the premium, who's going to offer the best price on that particular plan. And so the premiums and then also the medical underwriting can differ. Now, I talked about in my previous video, if you are enrolling in a supplement during your IEP, your initial enrollment period, there is no medical underwriting. You only have to worry about underwriting if you're wanting to change after that initial enrollment period. There are some states that have what they call the birthday rule, where every year around your birthday, you can change your supplement and you can reshop and find a better rate and not have to go through medical underwriting that way as well. So Plan G versus Plan N. Plan G covers almost all cost sharing except for the Part B deductible. Plan N is going to be a little bit lower monthly premium. You will have a copay for a doctor visit and an ER visit, where a Plan G, you would not have those copays. But the Plan N, you do get a little bit lower monthly premium. So you might consider, if you're somebody that doesn't go to the doctor a whole lot, you might consider a Plan N because you're just paying a little bit of a copay when you do go in exchange for a lower monthly premium. Plan N does not cover Part B excess charges, is important to note as well. Medicare Advantage, it says it replaces original Medicare, and there's a little bit of a misconception about that. You are still, of course, on Medicare, but you're not. When you go to the doctor, you don't show your plan, your A and B card. If you are on a Medicare Advantage, you're going to show the card from the insurance company. So what essentially happens if you are on a Medicare Advantage is Medicare has offloaded all your claims and all of your care to a private insurance company. So they're basically, I like to, the best way I like to explain it is as if Medicare or the federal government is buying you a private insurance policy. So all your claims are going to go to that carrier. None of your claims go to Medicare anymore. If it's an MAPD, Medicare Advantage prescription drug, it is going to include prescription coverage. You're going to have a network. Med Sup, there's no network. Now, an HMO, it's going to be a tighter network. You need referrals. You're going to have a primary care doctor. A PPO gives you more freedom, of course, and you can go out of network. You're just going to pay a little bit more for your care. On an HMO, if you go out of network, if you want to see a primary care doctor that's not in your network, you're going to pay for that cost. If it's an emergency, that's a different story. There is going to be a maximum out of pocket on the Medicare Advantage plans, and once you hit that, you're not responsible for charges beyond that. That doesn't include your prescriptions. And then benefits, doctor networks, all of that can and will change on a yearly basis. Generally, with a Medicare Advantage, you're going to have a hospital copay, and all of those costs, whether it's a primary care doctor, whether you're paying for lab work, whether you pay for an emergency room, hospital copay, whatever, those are going to apply to your maximum out of pocket, and you don't pay anything beyond that maximum out of pocket. Prescription drug consideration. Now, you do need to have a Part D plan when you're on a Medicare supplement. Medicare supplements do not include prescription coverage. That is very important to know. So you also have to have a Part D. So you may get a Medicare Advantage plan that includes Part D coverage, and it's a 0 monthly premium. Now, if you have a Med Sup, not only are you paying a premium for the Med Sup, your Part D is likely going to have a premium as well. So they usually bundle those together. Formularies, tiers, pharmacies, all that, those are going to vary across the different carriers. And it's something to pay attention to on an ongoing basis, especially if your medications change at all. And if you don't get a Part D plan right away and decide to get one later on, you are going to pay a Part D penalty. So this is what I talked about earlier. Medigap or your Medicare Supplement is guaranteed issue when your Plan B starts. Okay. Then after that, medical underwriting is typically required. So if you've been on a supplement for 10 years or 75 years old, let's say, and you have some medical issues and your supplement is getting expensive, you think you might want to change, you're going to have to go through medical underwriting unless you're in a state that offers the birthday rule. And then Medicare Advantage plans do not have any medical underwriting. So that same scenario, you can change during the annual enrollment period, AEP, we call it, which is October 15th to December 7th every year. You can change your Medicare Advantage policy. You can also stop your Medicare Supplement during that period of time and enroll in a Medicare Advantage, and you won't have any medical underwriting for that. If you do travel a lot, whether in the United States, overseas, a supplement would be the better choice. Also, if maybe you're a snowbird, so you live in one of the states where we get a lot of snow in the winter, but you move to Arizona, Las Vegas, somewhere in the south where it's warmer during those months, a supplement makes a lot of sense just because you're not going to have any network restrictions or anything like that. You would be having to switch your plan in and out every time you move if you're on a Medicare Advantage plan. And then Advantage plans, you're just going to be covered for emergencies if you don't change your policy. So keep in mind, and there's a lot of different factors that go into this. Your health needs are going to change over time, of course, right? Relocation, like I just talked about, if you're moving around the country a little bit, that's something to factor in. Medicare Supplement or Medigap plans are going to go up over time, and so you don't only want to choose based on the premium. You want to consider what your needs are now, what your needs might be in the future, what your finances are right now, what your finances may be in the future, right? So, like I just talked about, don't choose just based on premium. You need to understand the underwriting rules, and don't ignore the differences between your Part D prescriptions. So those are important, right? You need to make sure you have some kind of Part D in place, whether you're taking prescriptions right now or not. And then certainly it's a good idea to review that coverage annually, especially on a Medicare Advantage, because policies can change on a yearly basis. The network can change on a yearly basis. So keep that in mind. MedSup, your benefits are not going to change. Your premium can increase, but your benefits are not going to change from year to year. So here's the easiest way to make that decision. If you value predictability, flexibility, as far as doctors that you can visit, then you're going to choose a supplement. If you don't want to pay a monthly premium, if that just doesn't fit into your budget, then you certainly want to look at a Medicare Advantage. If freedom is important to you, but you can't afford a Medicare Supplement, try to get a Medicare Advantage that is a PPO. If you're generally somebody that doesn't go to the doctor a whole lot, and Medicare Advantage may give you some additional benefits like dental. Some plans cover vision benefits where Medicare Supplement is not going to offer that as well. So just depends on your situation. A Medicare advisor, someone like myself, can help you make that decision, what's going to be the best decision for your situation. So consider getting somebody involved that can help you with that. So feel free to reach out. My bio on YouTube has my link if you want to book an appointment with me. So feel free to reach out. If I can assist in any way, let me know. Ask a question below. I'm happy to answer it. If I need to make a new video to give more detail, I'm certainly happy to do that as well.